Hello class, my name is Ian Lowry and I will be doing my presentation on Vibrio Cholera. Starting off with the introduction, cholera is an infectious disease caused by the gram-negative, motile, facultatively anaerobic, toxigenic bacteria, Vibrio cholera. If you do happen to contract Vibrio cholera, expect to have severe diarrhea leading to electrolyte imbalances, and it can be fatal in serious cases. There are 1.3 to 4 million cases of cholera worldwide, leading to 21,000 to 143,000 deaths. Now, this number is probably an underestimate because cholera affects some of the poorest areas of the world that are not well researched or funded. So in reality, that number is probably much higher. A little bit of history about Vibrio cholera. Ancient texts suggest that cholera may have been around as early as the 5th century BC. However, the first well-documented pandemic was in 1817 that originated in India. Since then, there have been 7 total cholera pandemics. So here's a little bit of insight into what those pandemics looked like. On the left, this is an image from Fun magazine in 1866, produced in the United Kingdom, showing that these children were going to drink and then they would just suddenly die. On the top right is an artist's depiction of the Great Stink. So this occurred in 1858, where the Thames River became so polluted that Parliament ordered London's sewer system to be overhauled just because the smell was getting so bad. People were walking around with these scarecrow-like masks, as shown in this picture. And once the sewer system was overhauled, cholera cases actually went way down. So government officials didn't know for certain that the water was causing the cholera outbreaks, but because they took action due to the smell, the cholera cases actually went way down. In the bottom right is a memorial to a town in the United Kingdom that lost 185 people between June and October of 1832 due to a cholera outbreak that happened there. During this outbreak, it is estimated that every family in that community lost at least one person due to this outbreak. So the etiological agent, Vibrio cholera, is gram-negative rods. They are comma-shaped rods. They are toxigenic, highly motile, and they attack the small intestine. There is a chance that if your stomach is acidic enough, it'll actually neutralize or kill the Vibrio cholera before it has the chance to proliferate in the small intestine. And then there are many serotypes, but only serotypes O1 and O139 are pathogenic. The reservoir that it's found in, mainly found in water sources. It prefers slightly salty and warm conditions. Chlorine and bleach are effective at killing Vibrio cholera, which is why our tap water is treated with chlorine. And if you are in an emergency situation, you can treat your water with bleach. Sewers are a big contributor to, or improperly designed and maintained sewers are a big reason why cholera outbreaks can occur. Poor runoff techniques as well. If runoff is not being put in the right places and it's being directed into your drinking water, it can lead to the proliferation of Vibrio cholera. And then also poor water treatment standards. So let's talk about morphology and features. Again, it's gram-negative, has a toxin co-regulated pili. So this aids in the bacteria's ability to bind to the mucosa within the small intestine and proliferate. It does have a flagellum, is monotrichous at one pole. It is capsulated. So this capsule has O antigens on it, is a polysaccharide, and there's increasing evidence that if you have O blood type, you actually have a more severe reaction to Vibrio cholera and is a facultative anaerobe. So it can switch to fermentation in the absence of oxygen, which aids in its survivability. So let's talk about virulence factors and mechanism of infection. So it does produce the cholera toxin, and it utilizes a co-regulated pilus, and it also has accessory colonization. So this helps it to colonize within the epithelium and the mucosa in the small intestine. It does have hydrophores. So what it does is it sequesters iron and competes for that iron within the host. Another factor is the hemagglutination protease. So this is a very important virulence factor for Vibrio cholera. It induces inflammation within the small intestine, and it helps loosen tight junctions in the mucosa, leading to the release of water and electrolytes into the lumen. Let's direct our attention to the figure on the right. So the figure on the right shows Vibrio cholera releasing an AB toxin. Now this causes the activation of a G protein coupled receptors and the production of a cyclic AMP. Subsequently, chlorine, which is negatively charged, is released from the cell, and then sodium, which is positively charged, flows out to negate the charge differences. Water also flows out, causing the discharge, which is the watery diarrhea from the electrolytes and the water coming out of the epithelium. So the diseases that arise from Vibrio cholera is cholera. It is, where it does its damage is in the small intestine. The center image here is sort of an exaggerated look at the dirty water that is not filtered or cleaned or treated that will lead to the ability of Vibrio cholera to survive. And on the right is a child that's being rehydrated after being infected with Vibrio cholera. Signs and symptoms is a watery stool. It will not be bloody. So some people, it's a misconception that cholera leads to bloody stool. It's not. It's a watery stool that is often described as being rice-like. You can lose up to 1 liter of stool per hour. So if you do the math, losing that much stool per hour, you can actually die within a 24-hour period of time. It actually acts very quickly in severe cases. It also will lead to electrolyte imbalances, such as bicarbonate, sodium, and potassium. Vomiting can occur, but diarrhea is the more dangerous factor with this disease. And severe cases that lead to death can present liver failure, kidney failure, and even pneumonia from the fluid buildup. And on the right is a patient that is being treated for cholera. You can see that the severe dehydration has made him lose a significant amount of weight. The transmission is the fecal to oral route, mostly via sewage, so those feces getting in our drinking water and then not treating it properly. They also thrive on chitinous exoskeletons of plankton, and can live in shellfish, oysters, and then getting down to the microscopic level of the copepods and the diatoms. So for the lab diagnosis, the most reliable and preferred method by the World Health Organization is a culture of the stool specimen on TCBS agar plates. There are also commercially available immunoassays similar to the pregnancy test. However, these are not reliable. They can yield false positives, and they are generally not recommended. The most common way to detect for Vibrio cholera is simply looking at the symptoms. Treatment, the most preferred method is rehydration with clean water and electrolytes. Antibiotics can be used in severe cases, but they're generally not viewed as very effective. You can also give the patient an IV drip and give them zinc supplements, which there is increasing evidence to show that zinc supplements can help those with cholera. Prevention, the most The most effective way of prevention is utilizing the WASH method. So that's water, sanitation, and hygiene. Also, properly educating people on water treatment techniques, teaching them to boil their water, to treat their water, and teaching them where to get clean water. Also, modernizing sewage systems. Here in the U.S., we are pretty spoiled with good drinking water and sewage systems that are up to standard, but that's not the case for everywhere in the world. So making an effort to get these underfunded and third world countries better sewage systems. There is an oral vaccine. It should be taken if you are going to any of these places where cholera is prevalent. So special comments, there are outbreaks still occurring. In 2017, outbreaks occurred in Yemen and Somalia, which are still occurring today. A severe outbreak in Haiti in 2010 killed over 10,000 people. And interestingly enough, the cholera outbreak that occurred there did not originate from Haiti. It was actually brought in by UN workers from Nepal who had poor sanitation techniques in their UN camp that they had, which caused the cholera to spread throughout the country. It is often referred to as a disease of inequality because it is not very prevalent in developed countries. It is often ignored. However, it does still kill and infect many people all over the world, mainly in poorer areas and less developed countries. Here are my resources, and here are some questions for the class. Where would you most likely find Vibrio cholera? What characteristic is not found in Vibrio cholera? And finally, what is the most common treatment for Vibrio cholera? So please give these questions a go, and thank you for listening to my presentation.